Well, tonight, amid growing concerns over the Zika virus, Latin American health ministers are backing a public information campaign and boosting the number of medical workers to fight the mosquito-borne virus. So far, the Zika virus seems to pose the greatest threat to pregnant women. Joining us now is Africa 54 health correspondent Linord Moudou to tell us more about the disease and its impact. Linord.
Vincent, the Zika virus rarely causes problems for the people who get it, but it seems to be having a devastating impact on babies whose mothers are infected with Zika. The World Health Organization says the virus is strongly suspected to cause microcephaly, a condition that causes babies to be born with abnormally small heads. VOA's Pearson has more.
The Zika virus erupted in Brazil last May. And now, more than 4,000 babies are suspected of having microcephaly, an abnormally small head. The link between Zika and microcephaly has not been proven, but the World Health Organization says until scientists can come up with a better explanation, the Zika virus is the cause. This image from the Centers for Disease Control website shows a baby with a small head. The dashes show how big a normal baby's head should be. The CDC says microcephaly is unusual. Having microcephaly doesn't always mean the baby suffers from other defects like problems with speech, vision, hearing, movement, and intellect.
10 to 15% of American babies with microcephaly are completely normal.
In a Skype interview, Dr. Edward McCabe from the March of Dimes said the babies born in Brazil, shown in the videos, seem to have severe cases. The concern is how they're going to develop as they get older.
The key thing is the baby needs to be evaluated, doing an ultrasound of the brain, doing an MRI of the head. But the important thing is to follow the baby clinically, and it doesn't hurt to have early intervention.
That might include physical or speech therapy. McCabe also says not every baby will have the same outcome.
Our knowledge of microcephaly and babies with microcephaly prior to the Zika virus association is that there is a spectrum that stretches from normal to even high intelligence through the spectrum in terms of developmental delay.
Until more is known about this virus, doctors are telling pregnant women in Latin America and the Caribbean, and those who may become pregnant, to wear long-sleeved shirts, long pants, a hat, and use an insect repellent with DEET on any uncovered skin. Carol Pearson, VOA News, Washington.
As we've mentioned, countries and medical officials worldwide are on high alert as concerns over the Zika virus continue to rise. The World Health Organization says it is concerned about reports the Zika virus was sexually transmitted and has called for a thorough investigation. This after health officials in the U.S. state of Texas reported on Tuesday the first known case of Zika virus transmission in the United States. They say it was likely contracted through sex and not a mosquito bite. WHO spokesman Christian Lindmeier explains.
We have seen only 2 cases so far of sexual transmission. So while it seems possible that the virus spreads through semen and is possibly transmittable through blood, these are so far only the rare cases of transmission. What we do see is a huge majority of mosquito infections. But of course, it is important right now to study carefully this possible transmission of through sexual transmission. Right now, it's recommendable to practice what WHO has been recommending all the way along, safe sex, which would be the best way to prevent any sort of infection.
The Zika virus was discovered in 1947 in monkeys in Uganda. The virus, now linked to babies born in Brazil with microcephaly, abnormally small heads, is spreading in the Americas. While the links are still being explored, the WHO has declared an international public health emergency. Health ministers from Latin America gathered on Wednesday in Montevideo, Uruguay, for the first regional conference regarding the region's battle against the outbreak. Marcelo Castro, Brazil's health minister, revealed some details about the outbreak in his country.
Aproximadamente 4,000 There are approximately 4,700 diagnosed cases with microcephaly. It's important to clarify that these cases are cases that have been flagged, suspected, but not confirmed. In terms of confirmed cases, we have approximately 400.
Temos aproximadamente uns 400 casos.
Castro says Brazil is fighting the outbreak on a variety of fronts, including the development of a vaccine. The WHO is warning regions beyond Latin America, including Europe, Africa, and Asia, to be on guard. The WHO says so far, the virus has been transmitted in at least 32 countries, from South America to the Western Pacific. There is no vaccine currently available to protect against the virus. The Aedes aegypti mosquito transmits the Zika virus. And that's our Africa 54 health report for today. Vincent?
Well, Linord, thanks, and be sure to watch Linord Moudou's health reports every Tuesday and Thursday right here on Africa 54.